Mental health is very simple to understand. Occasionally, when people are defining mental health, they rather define the mental illness rather than the health. The health has to do with the state where an individual has the ability to cope with the normal stresses of life, can live independently, and can contribute meaningful to the society that he belongs. Yes, so that is the health aspect. So we teach people how to cope with the daily stress that comes our way, how to make a meaningful impact in the community. So if you are living and you are not making any impact in the community you find yourself, and you are either a nuisance, then it means that you need to come for assessment.
Okay.
Because if you are telling us that you don't have any mental illness, then you should be able to contribute to your society. Let us see the reason for your living or existence.
Okay.
Doing that, then you are mentally healthy.
There should be a reason for your living or your existence.
Exactly.
Okay.
And your contribution to the society that you are living at large.
So when can we, as family or loved ones, be able to tell there's something wrong?
Yes. So back again, people are always thinking, when you talk of people with mental illness, they are the people walking on the streets naked, looking smelly and other things. But that is totally not it. Anything that affects your emotions, you can be okay. There is something called high functioning psychotic disorder. You can be fine, you can be a CEO, but you are not okay. Yes. So when people get to know when they have these kind of things, that is the obvious things that people see. But anytime you see that a colleague of yours or someone closer to you has changed from how he or she used to be and is behaving differently, it should give you a clue. A typical example is that people all of a sudden becomes extravagant, where they tend to be giving their things out. The society that we belong, we take it like the person is very good. Oh, sister, we do yo, ni yemu yo. No. There are mental health conditions that can make him or her behave like that.
Wow.
Where he can be sharing his stuffs.
But there's blessing in giving, isn't it?
There's blessing in giving, but you see, where we are in this part of the world, a lot of people don't understand mental illness. Let me give you one scenario. We had a patient that went to the bank, cashed all his money, and he started giving it out to people. And you know how the system is now. Economy is very hard. So if someone is dashing you 200, wouldn't you take it? You will, right? So he started dashing his money out. People were coming, 20, 100, 50, 20, 100, 50. I think the following week or so, the money got finished. He went to the bank and he said he doesn't have any money. So he picked stones, put it in a key soap box, went to a car park and started smashing people's windscreen with the stones. That was when they got to know that there's something wrong with him. They themselves mobilized people, brought him to the clinic for treatment.
Wow.
But whilst he was sharing the money,
nobody realized.
No.
Wow. I'm happy SNM is here as well. Now, SNM, you have been able to overcome this.
Yeah.
And I'm happy to see you. I keep saying it because I know what you've been through to get here today. How old were you when you were first diagnosed with bipolar?
I was 21 when I was first diagnosed. So actually this year is my 10 years on my road to recovery and my mental health journey. Yes.
We thank God for your life. I think it's an wow. So 10 years.
Yes.
Walk us through the journey. What happened?
Okay, so it started when I was in level 100, my second semester. I ended a relationship I was in, and it's not it's not the traditional, he broke my heart and then it affected my mental health. I broke up with this person, and when I realized a few days my phone was no longer ringing, I wasn't receiving messages, it's like, wow, it's really difficult to be on this single street. So I went back, called the person, begged him, you know what, I made a mistake, I want us to get back together. And the answer was always no. So I started getting depressed. I didn't know it was depression. I thought, oh, that's signs and symptoms of a broken heart. So I realized on campus that I was finding it difficult to bath. to brush my teeth, to go for lectures. I was stuck in bed. It was a huge struggle. And so I had a friend, my roommates, they were supporting me. So my parents had no idea I was going through anything. It's when I came home for a long vacation, you know, at home, you can't hide whatever you are going through, that they realized that I was struggling to sleep. I won't sleep in the night. I would talk the whole night. What I'm talking about too doesn't make sense. And it was just really difficult for my parents to understand because it's like, you were fine. What happened? How did we get here? And I remember at the time I started, you know, hearing these voices, having suicidal thoughts. I just began to feel like, okay, if I die, it will be easy. I'll be free from this pain and this torment.
There was a voice telling you to die, to kill yourself?
Yes, you know, and I'll have these imaginations like of my funeral, me being laid in states and my friends coming and crying. I'll also have imaginations and thoughts where I'll be on the streets walking about and people will look at me and say, oh, that girl, she was in school, or she was fine. We don't know how she ended up here. So my mother was very concerned. My parents were concerned, but she decided, you know, let's go to church. So we went to different churches and some of them told my mom, you know what, she can never be well, it's over. So, you know, after trying different churches, my father was like, you know what, let's just try seeing a mental health professional. So the first one diagnosed me with schizophrenia. After some months, I was diagnosed with bipolar disorder. I was given medication, taken through therapy and all of that. Yeah.
I don't know. Maybe some of you, this is the first time you're hearing S&M's story. It's not my first time, but I still have goosebumps anytime I hear the story. Because you send your child to school, 21 years. You know, people say we go through broken hearts, and you know, broken hearts is something that everybody goes through. What do you call it?
National cake.
National cake. Hey, it's a national cake. Everybody will have to enjoy it. You know, so little will you expect that it will happen to you, and then it happened. And for you, you even broke up with him.
Yeah. I know, it's very ironic. And my mother has a brother who lost his mind through drug abuse. So for it to happen again in my family, I was very scared that I will end up that way. And my mother tried to be strong for me, but I knew that this has happened before, and if I'm not careful, that could be my fate. Yeah.
Wow. Doc, in this instance, is it that somebody will say maybe S&M is very emotional, that's why probably this happened to her? Or I don't even know what to ask you at this point. Let me say it like that, because somebody will be watching us this afternoon and say, oh, only broken heart, so you got bipolar out of broken heart. You know, something that we have all been able to go through. So what could have happened with S&M's case?
You know, bipolar is a mental disorder, and it is actually characterized with persistent feeling of being depressed, and also abnormal feeling mood disorder, where an individual thinks that what has happened to him, he has no hope or she has no hope. And this mood can interfere with a person's social and occupational function. To some extent, or to some extreme, it does affect the person's relationship, as she just mentioned. It can affect your day-to-day life. The reason being that with this bipolar condition, there are two things involved. And the things that influence the bipolar is what we call genetic predisposition, and that of the environment. You could hear her saying that the uncle, meaning that genetically she was already predisposed, but it needed an environmental factor to actually induce it. So the environmental factor that actually happened was the relationship issue that she actually went through, or she went in. There are times that someone's own could be substance. That is why we keep on advising the youth that you should be careful. Some of you don't even know your mother's side. You don't even know your father's side.
You can put
what
it
is
on silent.
happening.
Don't worry. Your
Okay.
people are watching you right now, and they are calling to tell you that, hey, Doc, I've seen you on TV.
Yeah.
It's him. He's the one on TV.
So those that they are calling me,
Yes.
I'm talking on. So they should watch me.
Yes, exactly.
So like I was saying, so we have the genetic predisposition and we have that of the environment. So our youth nowadays, we see them, involving themselves in all kinds of substances. If you don't know the lineage, the hereditary things that has to do with your own family, and you start involving yourself in those kind of practices, then if care is not taken, it will bring it. Because you are highly vulnerable or susceptible to it.
Right.
So the substance, and other people don't do substance, but stress.
Stress. So you need to know whether you are prone to it or not.
Exactly, you need to know. Very, very important. That's why programs like this are very important and crucial for viewers to actually learn something about it.
But other people who don't have it in their family at all, but they can get it due to stress.
Exactly. There is always a first time.
And the first person.
And the first person in the family.
Oh.
So the person that had it in the family, that was him bringing it into the family for the first time. And with your family, perhaps by God's grace, you've not gotten it, but you can be the first person. And that is why you should be mindful of your stress. You should be mindful of the substance that you've been indulging. And one other thing is that research made us to understand that the brain, the brain is a complicated organ and it has a lot of complexities. There are times that the structure of the brain, due to one or two things, may not look normal. That is after a thorough comprehensive assessment, MRI has been done. When you talk of bipolar, there are cortex in the brain, we call it the prefrontal cortex, and other cortex that are involved. There are times that MRI will prove that there are some deficits or defects that needs to be corrected.
Okay.
And apart from that, there are transmitters that we call chemical imbalances. For us to laugh, when we see someone and you really appreciate, like the way she was saying, she was first in love.
She was in love.
It was when she actually got to know that she herself went say, I don't need you anymore. Then later she realized that she was left alone in the street. And she realized that she has lost something that she has to go for it.
So that is what triggered her to get.
It could be.
Okay.
Because the neurotransmitters are chemical messengers. They help us to laugh. They help us to be happy. They help us to be sad. If things go wrong and there are imbalances, you are not different from what goes into your mind.
Right.
So if things happen and there are imbalances, it affects you.
Wow.
And that impedes your daily life.
So for you, SNM, you said you were seeing things, you were suicidal. Yeah. So bipolar comes in 2 stages. I remember the first time we spoke, you told me that bipolar, yours came in 2 stages.
Yes.
Tell us about it.
So I tell people it's a 2-in-1 mental health condition. You have the mania and the depression. So there were times that when I'm experiencing a mania, it was a manic episode. That's when I was doing the wild and the high things. Then sometimes...
Don't worry. The audience want to understand. Those at home also want to understand.
Yes.
Please, you can send your messages to us. Shola should be here any moment from now. She'll be reading your messages, so send it to us on 055-157-5757, 055-157-5757. She's actually walking in. I see her walking in right now. She's coming in to read your messages. So send your messages to us. And she'll read all your messages. Yes, you were saying.
Yes. So before I answer that, growing up, I had massive inferiority complex. So, getting into this relationship was a way for me to feel validated. So I always felt like I was not pretty enough, I was not smart enough. I had this imposter syndrome that nobody knew about. And so when the relationship didn't go the way I expected, that's what caused me to, have these depressive episodes. And for the first time I experienced mania, I sometimes tell people that when I'm manic, I don't know what I'm doing. It's like somebody has taken over my mind. The spending sprees I go on, being excessively generous.
So did you also go take out all your money from your account to share?
I didn't do that, but I used to tip people. Like, when I go to a place and maybe a security guard is there, I'll just give him money. I don't know him from anywhere.
But that's doing good.
You know, the difference is that it's excessive. Okay. There are times to when I'm manic, I just start putting away my stuff. I will tell my mother, I don't need this anymore, I'm giving it out. There are things that personally belong to me. I can't find them again because I don't remember who I gave them to. There was a time I almost threw away my university certificate because in that state, I felt like, give this out, destroy this. Even when I was on the ward, there was a time that I was like putting some of my things in the dustbin. So with the excessive generosity, I think that because personally, I love to give. So when I'm manic, it is heightened. And then when I'm manic too, I talk a lot. Naturally, I talk. Okay. When I'm manic, I talk a lot, telling you about these grandiose ideas I have. You know, sometimes the things I talk about, I can't like execute it. So I can come to you and tell you, Rosalind, I think on your show, you know, we should have a plane put here to make the show really nice. Meanwhile, it can't be done. But there are also the good sides. Sometimes the ideas can be executed. So abroad, when
I see people come to me to tell me that put a plane on the show or something like that, I should be able to tell that, no, there's something off somewhere, right?
So I tell people when the symptoms span beyond weeks, months, years, that's where you should be concerned. So if today you go home and you can't sleep, it doesn't mean you have bipolar disorder. So these symptoms I'm talking about, they go on and on and on. And another thing too was that I was struggling to concentrate. I would have memory lapses, and sometimes because I'm finding it difficult concentrating, I'll have these racing thoughts coming to my head all the time, and it affected my grades. It affected my relationships with people. My inhibitions were lowered. There were people that maybe they offended me. We talked about it. I forgave them. When I have an episode, I'll bring it up. And I'll even insult them. And then it's very difficult to go back and apologize and explain everything. Then when I'm in that state, I come down to the depressive episode where now I am stuck in bed. I'm not talking to anybody.
That's a depressive episode.
Yes, very low. I'm not eating. When I'm depressed, I don't even pick phone calls. I don't respond to emails. Last year, I had a depressive episode which was triggered by a throat infection I had. When I'm physically ill, it triggers depression for me sometimes. So in that state, I was withdrawing from everybody. I wasn't talking to anybody. And I just want to... I feel like the world can continue. Let me just deal with myself in this state. And it feels like a prison. Every day you are shouting, help me out, but nobody can hear you. And you desire that the following day you be yourself, but you can't be. It's like you are mentally paralyzed. It's really difficult.
Wow. Doc, this depression thing, there's so many people who say, I struggle with depression. Such people, can you actually say that they also have, you know, a bit of bipolar, or with bipolar, you have to have the maniac and what do you call it, maniac, right?
Yes.
The maniac and the depressive states.
Yeah, so it looks like a lot of people don't understand what is depression and what makes them sad. There is a normal fluctuation of mood. That is when you are sad or happy. That is how naturally we are created. There are times that who will say that since he was born, he has been happy throughout.
Yeah.
So those are normal fluctuations of mood. But depression is a mental health diagnosis. So the moment a doctor validates that you are depressed, then it means that you have gone through certain stages, or you've gone through a cycle that depicts under the criteria that you are depressed. You get it? Yeah, so that is how basically it is. And one thing is that, like she was saying, bipolar, it alternates between two things. Bi means two. So the mania, that has to do with the extreme abnormal form of mood where you become very aggressive. She was talking about wild. You are irritable. You don't seem to even pay attention to anything. Loss of concentration. You are not focused. At a point to the extreme, there is hallucinations because you begin to hear voices. There is thought racing. She made mention of that. There's this sort of grandiosity, overconfident. You feel like you can even
walk on the moon.
Walk, exactly, the moon, Choco-C. You feel like you can go and walk, and that is how come people, you know, get themselves involved in a lot of things. to some extent, there are people that with bipolar condition, because of the manic phase, they have high libido.
Oh, they become very sexual.
Yes.
Oh.
Because and normally people that are people take advantage. And not all people with bipolar, but some. Their libido does really increases. They have this high energy or increase for sex.
Wow. So then what happens? They start calling men or calling women to sleep with them or what?
I made mention of neurochemical imbalances. And the neurochemical imbalances, we have one called serotonin, we have dopamine, we have norepinephrine. These three transmitters play vital roles when it comes to bipolar. And when there is a default, for instance, serotonin has to do with regulation of our mood. Anytime a client experiences the depression part, we know that the serotonin level has really gone down. The dopamine has to do, we call it the love hormones, it has to do with we having an increased energy and becoming hyperactive. Now, with time, when they are in their manic phase, they seems to get closer to a lot of people. It is not their intent to actually go there for men to service them, or it's a man to go and service women, but rather because of the state that they find themselves, they become more vulnerable because they want to feel validated. When they are in a group, they want the people to know that they are there. And doing that, people tend to see them as being promiscuous or take advantage of them, but not all of them. Other school of thought also talks about their medication that they are on.
Some of the medications can do that?
That is other school of thought. And that is the reason why if you are diagnosed with such condition, you always need to speak to your psychologist, speak to your psychiatrist, because you are taking the medication and you can best tell what is happening to you. Medications are made in general, but you, the one taking as the client, will best tell what is happening in your system. And that is what actually happens.
All right. So for you, S&M, did you go through that state as well?
The sexual...
Yes.
Yeah, that around that time, I was still on campus, level 300. So what happened to me was, I was in a state of denial for 1 year. I felt, how can I have a mental health condition? And probably I'm the only one who is like me, who has bipolar disorder. I didn't know anybody out there who had the condition. So when I'm at home, my parents ensured I took their medication, but on campus, I would throw them away. And the symptoms got worse. It started affecting my personality. So I used to dress modestly, but now I started dressing seductively to class, and it was making me vulnerable and attractive to the wrong kinds of people. So around that time, I made friends with certain kinds of people who would try to take advantage of me and stuff like that. So it does happen. I mean, every normal human being, you have these sexual urges, but when you are manic, you just have this urge that, you know what, just, have fun, engage in this risky behavior, nothing will happen to you. And when the episode is over, it's like, why was I feeling this way? Why was I doing this? Yeah.
Wow. I don't know what to say. I don't know what to do, but you can still send your messages to us on 055 157 5757, 055 157 5757. Shola is coming in to read your messages. It's just something else, learning about this. So in terms of stigma, what did you have to deal with?
My first hand experience with stigma was in 2019. This was like my second job after national service. So I went to this beautiful school. I mean, they don't know about my condition. I was teaching there, but my stress levels began to increase because school closes at 2. But we, the teachers, have to stay behind till 6. And I was commuting from Afenia to this place all the time. It was a long distance. By the time I'm getting home around 9. I don't get time to take my medication early. So by the time I'm up the next day, I'm still feeling tired within, feeling drowsy. But I'll try to, suppress it. I go to school, do my work. But, when you have a condition, sometimes like you're a broken mark, you can only contain so much. Very soon it starts, seeping through the cracks. So on 2 separate occasions, not when I was teaching, on 2 separate occasions, we had these meetings and I dozed off and the head of the school called me out, told me to go and stand at the back.
Wow.
It was really embarrassing. Then the second time, it was another meeting with teachers and I was dozing off once again. And then the member of management who was there after the meeting, she said she wanted to speak to me. And she asked me what's going on. And I told her, oh, I have bipolar disorder. I've had this condition since 2015. I was even in school, University of Ghana, when it happened. I was able to still graduate. It's not like a condition that prevents me from doing well at work. This is just my story. And she seemed very, kind. Oh, she's going to read more about it. They'll support me in any way they can. Less than 24 hours, I was called for a meeting. And I was seated on the other side of the table. And the head of the school said, oh, Miss So-so-and-so tells us that you have something. Tell us what it is. And I told them. And the statement they made was, okay, let's hear from the school counselor. Whatever he says will determine whether you work with us or no longer work with us. The school counselor said, oh, bipolar, I don't even have to be working with children. I'm dangerous. Like, I shouldn't even be, I should go and find another job. And I just knew that, like, probably maybe if I had diabetes or cancer, they would have been more empathetic. But once it was mental health related, that was my last day. And I was indeed fired. I came home. Unfortunately, I didn't have an appointment letter to want to pursue it. A lot of people in the community, mental health community, were sad to hear about what happened to me because it happens a lot. People get fired every day because of their mental health conditions. But this was the first time I was coming out to say it has happened to me, so please help me out. And so that was my first-hand experience with stigma. Now, I think that for me, that experience toughened me. And because I'm doing a lot of advocacy, I'm on my YouTube channel, Mental Health Quarters, now everybody knows I have the condition. So the likelihood that someone will stigmatize against me is very low. And even if they do, I'm used to it now.
Are you working now?
Yes, I'm working now.
That's
but
great.
The time we met, I was unemployed. Okay, I was working then. I got unemployed.
But now you're working.
Yes,
we are so proud of you. So Shola is here to read the messages. Hi, Shola.
Hi, ma'am.
Yes.
You always give me your dress.
You look lovely, though.
Thank you, but it's your dress I'm eyeing.
Oh my God.
I was at the back, I was like, who is the star sitting there, shining, looking like flowers and roses?
So we are still on the mental health conference.
Yeah, there's something I want to ask because I schooled with a girl who had bipolar, but then she would come to you and tell you, I'm going to insult this teacher. And when I insult him, I would, I know that I'm insulting him, but I'll use my bipolar as my, my
cover up.
Yeah, my cover. And she did a lot. Whenever we run away from school and they catch us, she would say, I forced them to go. It's because of my bipolar. I'm telling you, she's lying to you. She went to use it to buy wachi. She won't write exams and a whole lot of, it was a whole brouhaha. So I'm asking, are you able to control? Because I think it comes all right, but then when it comes, she uses it to her advantage. So do people do that? Can it be controlled or she's faking it? That's what I want to know.
Depending on the particular phase, we made mention of two phases, the depression phase and that of the mania. And as part of the symptoms of the manic phase, I made mention of the person being overconfident. They always want to be that person that everybody will, praise or something. So there are people like that. They use the condition as a basis just to, make things easier for them. But the condition is also there. It is part of their symptoms that they display in doing that. And it takes an expert to know that there is something wrong.
Okay. Uber drivers decided not to pick her again because she had fought with everybody in the school and at the station. But anyways, social media has seen this and we have a number of comments. So let's get into it. This one says that, yes, what the doctor is saying about sharing their things is true. My grandmother's menopause was like that. She dashed all her clothes to people. Oh. That's what they do. This one says that, hi, Rosalind, you're looking regal. Okay.
Thank you.
Mental health is a very important topic which needs to be discussed often. Unfortunately, because of stigmatization and other factors, we tend to downplay it in our side of the world. We as people should take our mental health seriously because it could happen to anyone. As a friend will always say, many are disturbed emotionally, but few are roaming. Ministry of Health and Ministry of Education must take this seriously, and I am learning a lot on your program. Kudos to you and your team. Thank you so much. This one says that I am Bismarck Obiba from Mataheko, Afienya. Please ask my sister up to which level does she get to know that she is well or healed from the bipolar situation, and what actually brings the difference. This one also says that, good afternoon, please. Do you know that I was feeling things like sometimes I even go blank in my mind, or if I'm tired, I think a bit then I will have this severe ache in my head, migraine. But when I go to the hospital, mental health departments, the patron told me I am not serious because she said I dress well. I am going through almost everything she said, but when I share it to the people around, about how I feel, I think they just keep saying something. Please, I am Naomi. How do I help myself? So I think she's trying to say that anytime she goes to the hospital or to the mental health department and tells them, this is how I'm feeling, they downplay it because she dresses well, right? There's more. This one says that I think mental health issues should be taught in schools and media platforms. It will help to reduce the stigma. This one also says that I know of a woman who would burn all her clothes. Is that also a symptom?
Yeah.
You burn your clothes?
Oh, yes, yes.
Clothes.
You see,
Talking about this, I know people who go through, what's it called? Oh, what's the name of this sickness? Dementia. Some also give their things out and burn their clothes. Is it the same as bipolar? What's the difference?
No.
Is there also another mental health?
No, that is why before a doctor will actually validate you as having the condition, there is a criteria they use.
Okay.
Dementia is different from that of bipolar. Although they are all mental health conditions.
They are all mental health conditions.
Yes, but dementia is a separate thing from that of
But some
bipolar.
patients who struggle with dementia also have that symptom, right?
Yeah, the
of
symptoms,
sharing their things and all.
The symptoms cut across a lot of mental health conditions or diagnoses. It will take a specialist who is well endowed in that field to say there is bipolar, there is dementia. She made mention of starting from the beginning, someone diagnosed her of schizophrenia, which is also another mental health diagnosis.
Yeah,
but
this mental
later,
health thing, I think that we'll have to take it one by one of these days. There's schizophrenia, there's dementia, there's bipolar, there's what again?
Depression. There's
Depression.
postpartum psychotic disorder.
Okay.
You know body dysmorphic disorder?
Which one is the body dysmorphic disorder?
When at a point in time, you look at someone's buttocks, and you feel like you want your buttocks to be like that. When you look at someone's breast, and you feel like you want your breast to be like that. When you are a man, you stand in front of a mirror, you think that you are not a man looking at what you are seeing. You want your manhood to be like someone else, and you start chasing aphrodisiacs. A lot of them, we call it body dysmorphic disorders.
And it's a mental health disease.
They don't appreciate themselves. They always want to look that artificial person they see on social media. And that is a mental health disorder.
Wow. Any other?
But Rosin, that's why a lot of the young ones are doing the BBLs and, do you understand? So, for instance, I used to have body dysmorphia, working through it because then I learned that, you're nice the way you are. Do you understand? You have to understand that it's not everybody that will come with a big, backside. Everybody will not be a Rosalind Felly. Do you understand?
What do you mean?
No, but Rosalind, the number of things you are carrying at your back.
If
read
you pass
like 5,
read the comments.
Mine.
Comments are coming in. Yeah, a lot of comments coming in.
All right, but we do have a lot of comments coming in. This one says that I gave out my nice dress unknowingly and I don't know how to get it back. Oh, it's a part. Sometimes I withdraw money and buy gifts for people. I come to my senses when I get broke. I can be depressed and unable to sleep for about a month. Please, what do you advise me to do? There's more. This one says that she, what is she talking about? We can't look away. She talks too much, mostly about unnecessary things. Very annoying, but we understand now. Very captivating, though. We can't look away. I don't understand where this is coming from.
But I think he's probably talking about somebody.
Right.
Somebody's symptoms.
Oh, that's someone's symptoms.
Yes.
Okay. So that, yeah. She says the person talks too much and mostly about unnecessary things. It's very annoying, but we don't understand. Now he understands why she behaves like that. Yes. This one says that we thank God for taking you out of such mysterious sickness. That's what I was going to ask. People think it's very mysterious. And also, people think when you are switching from the regular to the bipolar, it's like you have to feel some spirits come over you. You have to get into another world. Do you understand? So, is it a mysterious sickness that people, you know, or there's more awareness of it now?
Yes, Doc.
It being a mysterious sickness, it is there. Like I define what it is a mental health disorder.
So it's not like a mystery like people always
it is
think
a disorder that is there, like what she was saying. Someone may be diagnosed of having malaria, fever, any of the medical conditions that is there. In psychiatry, there is also a condition that is there.
You know, for most people that go through this in Africa, part of the world, the first point of contact is church.
Yes, it's there.
And Asenam, you said you went through the same thing.
Yeah.
Could that be the reason why sometimes we are not able to curb it early? Because probably when we notice it early, we're able to prevent it from getting into a different level. Is that it?
Honestly, when you come to the hospital settings, we don't rule out entirely spirituality from the care that we render to our client. But honestly, it is going a wrong way to some of the patients. Sometimes before it gets to us, it has turned chronic. The reason being that there is this low level of knowledge when it comes to mental health education, especially to that of a lot of the churches. And they tend to spiritualize almost everything.
What about those that, have switches in themselves? There are people that will tell you that this is Rosalind. Then the next minute I'm like, I'm MFR. The next time, I'm Akosia. What about that? Is that also a disorder?
Yes. You see, with that, there are a lot of things that goes in. We talk about it. We have something called the positive symptoms of psychosis. The positive symptoms of psychosis has to do with what we call delusions, illusions, hallucinations, and the rest. So with the hallucinations, that is when, if it is auditory hallucination, the person tends to be hearing voices. They hear. So I must tell you, there are a lot of people that are saying that God has called them. It's not God has called them. Insanity has called them. The reason being that you will hear voices like the way people hear. Just look at my face. I'm talking.
I'm trying to look at your face at this point. Because the number of pastors that I know that they say God has called them.
No.
It's not always.
I'm telling you. Because the auditory hallucinations, you hear voices. With a visual hallucination, you see things. You can be two. He tells you that he sees three people. Sometimes he tells you dead people coming. And that is when they tend to give all kinds of directions that you seem not to understand. But because we've made ourselves spiritual people, highly spiritual, unquestionable, what happens is that when you give the direction, you can't even go and find out whether it's true or not. But when you come to the psychiatrist settings, it will bring you to reality.
Shall I read more of the messages?
At this point, this one says that, hello, please, good afternoon. I need your help by doctor's number, please. So I think
he will leave his number before.
Right, this one says that my bipolar experience is unheard of. I literally lived in fear all my life for the past 4 years now.
Wow.
At a point, I don't want to be near my kids nor communicate with anyone. I just wanted to stay in my bed the whole day without doing any work. My libido is zero, my emotions are zero, and nothing makes sense. It's all fear and tears for 4 years now. Overconfidence, I talk too much and I'm afraid to sleep, just afraid to sleep. My name is David, right? This one says that mental health, total health, mental health illness, total health illness, mental health, it could be you. I am Esther Ohene in Japan. So, yeah. People are battling a lot inside that
this
they
has
do
been
not
a
say.
very, very deep conversation, I
Right.
must say. And so I want to say a very big thank you
No.
for making time to be with us this afternoon. SNM, thank you so much for taking this upon yourself to share your story with the world, to encourage others, educate people about mental health illness, and also be the mouthpiece for those who are struggling with it. Thank you so much. And Doc, thank you so much for being here. You've made us know a lot. And I think that what we'll do, probably we'll do a series out of this. This has been the bipolar one. Maybe the next one could be a different topic. We'll bring all these to people's doorsteps, because there are so many people who are battling these diseases without even them knowing. And so a very big thank you to you, Frances Yeboah and Esinam Dra. We are very, very grateful that you made time. Give them a round of applause.